Hello, everyone. Thanks for joining us on the media briefing on this rainy and stormy Wednesday. We are going to start our briefing with a representative from Office of Emergency Services to give us an update on what is happening at the Operations Center and any storm updates. Tracy Mofino joins us. Hi, Tracy.
Hi, good afternoon. Thank you. Just as everybody knows, the storm event started yesterday evening and is still occurring. We're expecting some additional weather to come up from the south this afternoon, so everybody is preparing for that. The Sheriff's Office has, as you know, evacuations in place and road closures in place along Highway 1 as well as River Road and some other areas. For some debris flow and mud that has crossed the road. We have the 3 evacuation points in place, as well as sandbag stockpiles in place. I placed the links and locations in the chat for everybody. If you haven't seen it, they're on our social media pages as well as our website, as well as the SPCA for animal placements and evacuations. So the Sheriff's Office is making the determination on closures and how long they're going to be an evacuation orders in place. And obviously they're still evaluating that because the storm is ongoing. We ask that people drive carefully and not try to drive through roads that have standing water on them. We've already had the deal, or the Sheriff's Office and Highway Patrol have already had the deal with several vehicles stuck. So that's where we're at. We're just waiting and continuing to respond as needed. The Monterey County various fire agencies, from Kashawa Fire to Monterey Regional to the state fire agency are responding as well, and they have stood up extra staff to meet the need.
Thanks very much, Tracy. And I know it's been a long 24 or 30 hours for you and all the staff over at the Emergency Operations Center. So we want to let Tracy go. So if there's any questions regarding what Tracy just talked about or questions for OES, this would be the perfect time to do it. Normally we wait until the end, but we want to let Tracy have a break. So here's a first question for you, Tracy. Is there a preliminary report on how many slides have taken place in the county? Any injuries?
We do not yet have the preliminary count. We still have obviously the agencies and entities out in the field evaluating that. There's areas that we still, Highway Patrol, Caltrans are not able to get to along Highway 1. They're waiting for the weather to clear a little bit before they get further down Highway 1, but we do not have a number yet for how many closures. The most up-to-date closures are on the map on our website, and that's updated as real time as we can get when the closures are reported or their reclosures are made. I do not have a number on any injuries, if there are any at this point.
Right. How many, do you know how many people were evacuated compared to how many homes were under evacuation orders?
Our count as of yesterday, there were 2,400 structures in the evacuation warning and then evacuation order area, which equated to about 7,900 residents in the evacuation warnings that turn into evacuation orders. So those are the numbers. I don't have an exact number or even an estimate of the number that the Sheriff's Office actually contacted. Those are the numbers that we provided notifications to for both the warning and the orders.
And I know I've got a question in here. I think you just referred to, the question was about severity of the mudslides and rock slides, and that you had indicated they're still doing assessments of those in the field right now, and probably more information will come out about that a little bit later.
Yeah, absolutely. I mean, obviously, especially the rain down in the Dolan, burn-scarred Dolan Fire in Big Sur is still ongoing. So it's really hard to get in there. And then we have closures along River Road and into those areas as well due to mud flow and debris across the roadway that we're still responding to, and that all the agencies are responding to and are out in the field dealing with.
And is there any additional concern as the rain seems to have stalled and is expected to dump more rain over the Big Sur area? Do you know how many people refuse to evacuate from that area? And I think this question is specific to the Dolan fire.
I do not have a number for you for the people who decided to shelter in place or not heed the evacuation order. I know the sheriff's office, I'm not sure if they're on the call, but I know they did make contact or attempt to make contact with every structure and residence in the area. And we're pretty successful at that. But there are obviously people that chose to stay, and I just don't have a number for you.
Okay. And then another question for you. Will the temporary evacuation sites, will they stay open throughout the night tonight? I know initially they were designed to be 24 hours, and is that still the case?
That is still pending, depending on how well how quickly this storm passes. But some determinations we made more into the afternoon on that. I would check our website, and we'll be releasing that information this afternoon, just confirming that they're going to stay open. But to give you a hard and fast, yes, they'll stay open tonight and through tomorrow. I don't want to do that if things change. So check back both on our website and through our social media accounts to confirm that.
And are there specific areas where the focus will be in terms of cleanup efforts that you know of?
Highway 1 and the Dolan Bernska area is one. Is also one that it's pending an evaluation by Caltrans as well, trying to get down into their 20+ miles worth of road down there that is closed. And then the River Road and those areas are probably the two focus areas for cleanup.
Right. And then I have a request if you could repaste the notes, excuse me, that you mentioned in chat that you pasted earlier. If you could repaste them for those who joined in late. And then just a follow-up question about focus areas. Are the areas that they're focusing on that you just described because of the expected and continued rain?
The Dolan fire, especially because of the expected rain, the River Road and other areas because of the rain that was already received.
All right. That, here we go. Another question. Were there no slide issues in the Carmel fire burn scar area that you know of?
Still awaiting word on that. There is probably some that we're still waiting word on. So I can't give you a hard and fast. Obviously, this is still an evolving event, and those slides, because of the rain, can and will still take place. But the county OES website will have the actual road closures and slide locations.
And then this is a great question for those of us who have been around the county for a few years. When is the last time Monterey County had a storm like this? And I don't think it was too long ago.
Well, this is obviously the first one this fire season, and it's made infinitely more severe because of the three fires that we had and the burn scars. The last fire, I don't have an exact date for you.
So I think after Soberanus, there was some significant rainfall, and then there was that small matter of saturation in a bridge on Highway 1 too. So
that's correct.
All right. And another question for you before you go. Do we know how long the evacuation orders will be in place?
No, that's up to the sheriff's office, and they're continuing to evaluate it because of this weather that we're still receiving. Sort of the second portion of this river of water that's coming in before it clears out, and they're able to fully assess the areas that need to be cleaned out and before the evacuation orders can be lifted. But the sheriff's office they're out in the field making those decisions.
All right, thank you. And that's all the questions that I've got for you now, and I'm going to let you take your 30-hour lunch break.
Thanks, ma'am.
All right,
take care.
Thank you.
Bye-bye.
You too. And so now we're going to turn to COVID topics. And we've got on the line Rosemary Soto from our administrative office. In the Board of Supervisors meeting late yesterday, Rosemary shared a report on the disparate impacts of COVID in Monterey County. And she has agreed to come on the media briefing today to give a shorter version of that, because it's really a great follow-up to the work that a lot of departments are coordinating to help those most impacted by COVID. Hi, Rosemary.
Hello, good afternoon. Thank you, Maya, for this opportunity to share. And I'll be brief and just share a couple of highlights. So the disparate impact report was prepared and shared before the board in August just last year. And so the direction of the board at that time was to prioritize strategies that were outlined in that report, which were recommendations that would address the underlying conditions of the impact, which was disproportionately more severe in communities of color. And so what we've done with these strategies is gone through a prioritization process and determined which should be dealt with first. And of course, as you can imagine, all of them were a priority. So what we ended up finding is that several of those strategies really were needing legislative advocacy in order to be able to move and advance those strategies into implementation. And so our legislative team, led by Annette Diadamo, has worked extensively with our legislative partners and worked to move on those policies, and some of them are requesting support and funding from state and federal sectors. And so we also looked at other categories. Strategies fell into various categories. One of them is response and recovery. And the strategy was to ensure that we have a racial equity lens into our emergency operations center. It was important for us to look at having a person within that center who would be able to assist in providing more of that effort, or that conscious and intentional effort to address and serve the communities that were most disparately impacted in the best way possible. So this kind of adds like another layer of consciousness and awareness to the work. And what we do have our colleague Lubna Mohammed, who works in the County Emergency Operations Center. Her role is to develop a community resiliency framework. And that framework definitely lends a racial equity lens, not only to language capacity and cultural relevance to its communication methods and messaging, but it also it covers other aspects of disaster response. So resiliency being the ability to prepare for, cope with, and overcome and positively adapt to and recover from change, including those adverse and stressful events. And that framework, which is still currently in development, it's a community resilience plan that will be brought to the Board of Supervisors in early spring, but they are continuing to implement some of what they find in the analysis of that plan, which focuses on capabilities and strengths, risks and needs, and current resilience projects. And of course, learning from these experiences of, current emergencies, past emergencies, such as the COVID-19 pandemic, fires, etc. And then currently what we're dealing with now is the flash flood. We also have a strategy that focuses on health and all policies. This is coming from our health department. Dr. Krista Honey is the lead on that project or that initiative. And health and all policies really looks at all aspects of government and looking at the relationship between building and action, through developing a toolkit that can be used by all department heads and staff. And this is looking at what are those best practices. We refer to it as HEAP, Health and All Policies. That's their acronym. And looking at those information that could help our department heads to prioritize their projects in a way that also includes health equity as a center point of their work. More intentionally, there are efforts going underway to identify linkages and alignments of those strategies into newly identified HEAP projects with county partner efforts such as Blue Zones, Foundations, economic efforts, and climate change and sustainability plans. So bringing health equity into various aspects of our collective work. And another sector of our work is to also continue to focus on the enhancement and expansion of our community health worker project, of which we've shared with you in the past, and how that is a project that was supported by the Board of Supervisors with funding for expansion. We also looked at our housing category, which is an area led by our colleague Melanie Barati, and she shared about the collaboration between the agricultural industry and the farm worker housing developers. And then the cities and counties are also all working collectively together to look at strategies that were formed with subcommittees in 2017. That's the Monterey Bay Economic Partnership, and others that were looking at strategies to incentivize affordable housing development. And also facilitating permitting and inspection for employee housing programs for H-2A employees, looking at the spring coming around the corner, where more than approximately 55,000 of our agricultural farm workers are due to return to the Salinas Valley. It was very important to be looking at how do you include healthy housing and public health accreditation principles into new developments that might be coming down the pipeline. And also utilizing county GIS data that would be combined with zoning code requirements for housing developments to map where those target areas could be based on the complexity of permits that were required. So just easing, facilitating those processes a lot better for developers in our community as well. And there's currently some applications for state grants to support planning for moving forward to implement more affordable housing projects, as well as, in particular, one of those grants is the state SB2 grant funding. So another aspect, another area of our work is the digital divide. We have our Information Technology Department Director, Eric Chatham, who has been leading an effort, collaborative effort to address the digital divide in partnership with our local school districts, cities, and of course the County of Monterey, and community partners to address the digital divide for our local students, other county residents, and particularly in rural parts of our county, and then also to advocate for solutions at the state and federal level. Most recently, there was a partnership developed with the North Monterey County Unified School District to review the wireless coverage for approximately 4,547 homes and provide hotspots at 50% discount to 1,300 students. They supported the Monterey County Office of Education CARES funding for acquisition of 3,324 Chromebooks and 1,800 MiFi devices for digital access, and that was supported through the CARES Act funding. We also initiated projects to install and enhance outdoor Wi-Fi to 25 county occupied buildings, and this was done in 2 phases to extend coverage to approximately 328 feet beyond the building parameter. And so those initial areas that were covered include Salinas, King City, Marina, Seaside, and Monterey. And proposing legislation to expand broadband and cellular coverage, reform existing, and also to reform existing state programs and expand internet access and regulate broadband internet access as a utility by the FCC and CPUC. And I'm not sure if I'm going over time, but I just have one more category to share out, and that is in the Justice Department. We have our partners in the justice system. This includes the District Attorney's Office, Sheriff's Department, Public Defender's Office, and then of course in partnership with the Superior Court. So they do continue to abide by the Cal OSHA safety protocols in workforce, working remotely, but also the Superior Court continues to offer or allow, I should say, remote appearances and hearings whenever available. Our justice partners make every effort to ensure that the safety of victims and witnesses continue to be protected. And then create space in the office for witnesses and victims to testify remotely if allowed by the court, and have a victim witness advocate assist with technology. For incarcerated populations, the emergency bail schedule that has been extended continues to keep our local jail population smaller. And even if courts have returned to handling calendars roughly the same size as prior to shelter-in-place orders back in March of 2020. So more cases continue to reach final disposition. What's new in our local state prisons is that CTF and Salinas Valley Prison are coming up to speed in remote court appearance capabilities. There's one courtroom that handles crimes committed in our local state prison facilities. And currently we have essentially been at a standstill since transportation to court has not been a safe possibility. And inmate attorneys have not been able to engage in confidential communication with their clients since March of 2020. The Monterey County District Attorney's Office has stepped in and facilitated communication between the defense attorneys and CDCR legal to implement court orders for these confidential communications to take place and get cases moving. So the CDCR has made communications take place and has made efforts to increase remote capabilities for their inmates with the purchase of more equipment and operations plans within the prison sites. And they also continue to collectively work together in misdemeanor cases, making what they have termed COVID offers that take into consideration the need for final disposition in an expeditious manner. And so of course our justice partners continue to work really hard together to make sure that they are ensuring the safety of the community despite the challenges that the pandemic has presented. And so it's a brief overview of a much longer presentation that was given yesterday, but thank you.
Thank you, Rosemary, very much. And we just want to keep everybody up to date on the progress of this work. And speaking of lobbying and advocating efforts, we're joined by Chair of the Board of Supervisors and 4th District Supervisor Wendy Root Askew. One of the end results of a really broad discussion yesterday on the vaccine rollout for Monterey County was the need for advocacy for vaccine and the need for vaccine. And Supervisor Askew is here to talk more about those advocacy efforts. Good afternoon, Supervisor.
Hi, thank you for having me. Jumped right in from another call I was on, but just want to highlight a few points of the discussion yesterday that the Board of Supervisors had in regards to recognizing that there are some, a number of issues that we need to ask the state for additional support and assistance in. One of them being that Monterey County does have some very unique populations and needs that differentiate us in some ways from the rest of the state in terms of the seasonal farm workers and the high numbers of undocumented workers that we have and individuals and family members that we have living here in Monterey County, and the need to uphold the commitment that the state has made to equity and delivering additional vaccine to Monterey County so that we can ensure that our food safety workers and our food, our agricultural workforce is safe and protected from continuing to be at risk of catching this virus and spreading it in the community. So in addition to urging the governor and the California Department of Public Health for additional vaccine, recognizing the unique needs of Monterey County, we're also asking the California Department of Health and the governor for increased transparency about the data in regards to how vaccine is being distributed to counties throughout the state. I think there's we could go into a lot of other equity issues, but Monterey County is prepared to deliver vaccine to our residents. We have 32 sites currently ready to go to pop up as mass vaccination sites. We have another 91 sites that are under finalization for contract. We have our staffing teams and our vaccinators who are ready to deliver vaccine to county residents. And what we need clear and consistent delivery of vaccine dedicated to our population, and that we need that vaccine from the federal government and from the state.
Thank you very much, Supervisor Askew. I know yesterday's meeting went so long, and I wanted to make sure all of our reporters who have been monitoring this issue really get a good and clear understanding of the county's efforts in this area. And if you could stay on the line, if you're able to answer any questions that we might have. We were supposed to go next to Dr. Moreno, and I hope he can hold on for another few minutes. Our Public Works, Randy Ishii from Monterey County Public Works has been able to come onto the line. And I know people had questions about damage and assessments, and I'm hoping he can tell us a little bit more about what's going on out in the storm areas. Hi, Randy.
Hi, man. Thank you very much for inviting me on.
Thank you for joining us just on the fly.
Well, that's how Public Works has to roll in serving the communities. So by way of a brief update for the community, we had winds come in with high velocities yesterday evening, followed up by some fairly high intensity rainfall event storms. Varying areas along the coastline received varying amounts of precipitation. What we experienced over the evening were various tree limbs that were felled, various trees were also felled by the winds, and unfortunately there was enough moisture in the soils and some of the burn scar areas from the 2020 fires that there were some landslides on those places that experienced the 2020 fires. By way of brief update, River Road experienced several locations that have material, aka debris flow, onto the road. Pine Canyon Road, which is a road off of River Road, has debris material across it. And so at this point in time, there are road closures along River Road in various locations, approximately from Las Palmas to the north, southerly to even Fort Romeo Road. Currently, Public Works crews are trying to clear the road to allow emergency access and have acquired that emergency access at this point in time. However, there is so much material that we're calling upon our emergency contractors to fully clear those roads of debris. And we anticipate that going throughout the rest of the day in an effort to get the road fully reopened for the public as soon as possible. Kashawa Road is a road that experienced the 2020 fires. And upon damage assessment review, that road appears to have only some rockfall debris material on it and some water ponded areas. However, that road is open. Well, we were not able to proceed further to the south in the Dolan Fire region due to the State Route 1 road closure. However, there is such inclement weather that's coming in again. It is not wise to send people down there. And so at this point in time, we will assess that as soon as weather conditions allow. Please check into our road closure and information page for a latest status update on any road closures or issues that we are addressing. And I will stay on the call for any questions at the end. And I see there's a question that did come up in the chat.
Yes, if you could go ahead with that. Just take that question.
Thank you. Pine Canyon Road is still closed. However, a lot of material has been cleared off of that roadway.
And so additionally, I think that the reporter not only wanted to know about the closure, but how severe is the slide on Pine Canyon Road?
My understanding was that there was anywhere from a few inches of material on the entire road to a good foot of material. That said, members of the community plus county crews have worked together to clear out that material. Much of that material is what I meant to say.
All right. And while we've got Randy on the call, if there's any other questions for him, go ahead and put those on chat right now. And then when Randy leaves, we're going to hear from Dr. Moreno, and he's going to do questions only. So if you've got questions for Dr. Moreno, go ahead and start putting those in chat as well. Randy, I've got another question for you. Is there a preliminary report of how many slides have taken place in the county?
While I do not have an exact number at this time, there are several slides primarily along the River Road corridor.
All right. I've got some questions coming in. Let me see if there's anything here for you. I'm not seeing any more questions for you. Is there anyone with any questions for Randy before I let him drop off the call? Any slides? I think you said you weren't aware of any slides in Dolan, but the Carmel and River fire areas. I think that's where River Road is, correct?
That is correct. So the River Road fire burn scar area has several different slides that have occurred. It is difficult to quantify an exact number of slides because a road length is miles long and there's several slides within just that one portion. So as I reported earlier, there are several slides along that entire River Road area, and we're working as rapidly as we can to get those cleared. And with regards to the Carmel fire burn scar, as I mentioned, there's only some rock fall material and some incidental water ponding along Kashawa Road. However, we are not seeing any debris slide material on on Kashawa Road from the Carmel fire.
All right, thank you. And I think that is all the questions that I've got in for you. So I'll let you get back to assessments. Thanks very much, Randy, for joining us on the call and giving us an update on Public Works efforts. All right, so then we're going to move into our last COVID item, and I'm hoping Dr. Moreno is still on the line with us. Dr. Moreno, are you still there? There you are. All right, I've got some questions for you, Dr. Moreno. I know you've had several days worth of presentations, and so let's get going with questions that people might have. Based on the current levels of vaccine allocation, can you give us a timeline when the various steps of vaccination implementation, as outlined in Appendix G of the county's mass vaccination plan, will occur?
Not sure I have an answer for that. I have to go back and look at Appendix G.
And maybe there's a broader answer for that.
Sure.
Is there a kind of a timeline on these various steps in the mass vaccination plan?
Why don't I, Maya, why don't I pull up the plan, and while I'm doing that, maybe you can see if there's another question.
All right. Here's another question. Is the county receiving vaccine, then distributing to hospitals and healthcare providers? Or are hospitals and healthcare providers able to order and receive their own vaccine dosages? This question has several parts. We'll start with that one.
Yeah, thanks. So the state of California, after determining how much vaccine the feds are giving to federal agencies here, and after determining how much of the state allocation is going to go to state organizations like state prisons, this is left with vaccine that can be allocated to counties. And so based on a formula, we get our share of that vaccine allocation. And that's what's referred to as the allocation to Monterey County. And then from there, we identify providers that have been approved by California to receive and administer a vaccine. And we look at which providers are able to, have been in the past demonstrated that they can be efficient in vaccinating the populations that we're trying to get vaccinated. And so we then check with those organizations and inquire about their vaccination plans and the populations that they can vaccinate, and how many people they can vaccinate, and the strategy that they would use. And then we make a determination about how much vaccine to send out would go to each of those providers. So with that, the providers then submit their orders, and we verify and confirm the order amount and the type of vaccine that they're requesting, and we approve those. And then that information goes to the California Department of Public Health. And then from there, CDPH notifies the CDC. CDC then approves the order for California and all its counties. And then CDC notifies Pfizer and Moderna of the order request. And then Pfizer and Moderna ship vaccine directly to the provider.
All right. And then the second part of that question is, has anyone started to vaccinate 75 and older, age 75 and older, in Phase B Tier 1? And I'm assuming that this is in Monterey County. And how are those 75 and older able to get an appointment to receive a vaccine?
So I don't know if anyone has vaccinated 75 and older. Hopefully those healthcare providers who have available vaccine for that, they can make available for that population are doing so already. And then each individual who's 75 and older, or someone who's assisting someone who's 75 and older who is looking to get vaccinated, they can go to our website, but they can also go to the websites or call the call centers for our 4 hospitals and inquire as to whether or not the hospitals are making the vaccine available to 75 and older. And if they are, how do they can ask the individual at the hospital call center what the process is for getting a vaccine. The other way that someone who's 75 and older could inquire about a vaccine is to call their healthcare provider. In particular, if the individual is a patient at Clinic of the Salud or our own county clinics, that'd be the LSL clinic, Seaside Clinic, the Laurel clinics here in Salinas, for example, or Soledad Medical Group has received vaccine. And so if you're a patient of one of those organizations, you could call and find out whether or not those providers will have vaccine available, and if so, could see if they can schedule an appointment.
Thank you. And then do you want to jump back to that Appendix G question?
Yeah, I'll probably have to look it up and get an answer back to you, May, and then you can reply on my behalf to the reporter. Thanks.
All right, thank you. Another question, who is the MCHD or Monterey County Health Department vaccine coordinator, and will this person join regular briefings with the media or host regular briefings with the media?
No, it's just going to be me, Maya. So
here you are,
yep.
And you've already achieved that first order of business for your new job. Here's continuing with more questions. It appears that Monterey County is receiving far less than its fair share of vaccine. Why is this happening, and what is being done to rectify it?
May I don't have any evidence that we're not getting our adequate or appropriate proportion of vaccine. So some people think that we are, but I don't have any evidence for that.
And then the second half of that question, why? Well, it could be then, why are we getting the amount of vaccine that we are getting? Mm-hmm. And what could we do to get more? Okay, sure. So we get vaccine based on a formula that the state modifies from time to time. Currently, the formula looks at the population. So that's just population based, but then it also looks at the amount of, now it looks at the amount of individuals that are 65 and older. And so if a county has a greater proportion of their population being 65 and older compared to another county, there would be some adjustment made in the formula from what we've been told that might get that county slightly more vaccine because they have greater proportion of their population is 65 and older. So the state is also looking at incorporating adjustments based on equity as well. And I don't have any information about what that equity adjustment is, but we've been told that there's some adjustments there also. And so that's how they base it on a formula, and then we get the amount that the formula determines we're going to get. In terms of trying to get more vaccine, there is a opportunity each week for counties to submit a request for additional vaccine if the state is aware of any vaccine that is available and not already allocated to a county or not already allocated to a state organization. So we've submitted that request, and many counties similarly have made the request, but we haven't received any additional vaccine, and most of the counties that I know of haven't received any additional vaccine either. It's just
right now. The state confirmed for us today that counties are taking all of their allocation and getting it out to providers.
And I also think additionally, Supervisor Askew spoke to the equity issue as far as what is being done to rectify that. That may not be something within the health department's purview, but lobbying for improved supply or distribution may have to come at a different level. And I don't want to speak for the supervisor, but am I paraphrasing you correctly, Supervisor Askew?
Maybe repeat that and I can confirm.
We had a follow-up question about what could be done to get more vaccine, and Dr. Moreno responded from the health department how they're trying to get more when there's the opportunity to ask for more, they do. But getting more vaccine may be beyond the health department's purview, which is exactly what you were speaking to earlier.
Sure. Yeah. I mean, I think that the state is making their decisions, and it's up to us to make sure that the state understands the unique conditions facing our community. And without our ability to communicate with the state and let them know that we do have unique equity issues here in Monterey County, that we've been hit hard by COVID, that our residents are suffering, that we have demographics and populations where COVID has, because of the workforce not being able to stay home, we have additional unique needs, and the state needs to. We're asking the state to consider those unique circumstances as they develop their formulas for allocation. And if we don't tell them, they're not going to know. So our job as local electeds is partly to make sure that we're communicating exactly what we need so that the state knows what we're facing here locally.
Thank you, and thank you for adding in to the answer to that question. And then I have one more question for you, Dr. Moreno. How many requests has Monterey County made to the state to get more vaccine since vaccine first became available in December?
So we've made one request and we haven't received any vaccine. So we won't be, I don't believe we're going to be making more requests unless we get additional allocation. So putting in more requests probably won't get us any more vaccine if there isn't any vaccine to give out.
Right. That is all the questions that I have from people in chat. Is there any other questions for any of the folks still on the line before I let everyone get back to their day jobs?
I'll just add too that the letter that the board authorized staff to draft to send to the state, that we will be making that available publicly as soon as we have it finalized.
Thank you. Thank you very much. And then Dr. Moreno, a follow-up question to the vaccine request question. When did the county make the one additional vaccine request?
Yeah, thank you, Matt. I don't recall exactly. It was recently, but I don't recall exactly when staff submitted it.
All right. Thank you. And that is all the questions that I have. Thank you all very much for joining us on the briefing today and sharing all this wonderful information. Our next briefing will be next Wednesday, and we'll see you then.
Right.
Good afternoon, everyone.
All right. Bye, Matt.
Bye-bye.